All right, welcome everyone to another shadowing session at Hearts for Health. I hope everyone's enjoying their Labor Day today, an extended weekend. Today, we're joined by Dr. Daultani for a session about periodontology and implantology. She is a very renowned periodontologist and implantologist in India, practicing in India, and is the recipient of the International Award for the Top Doctor's Choice Awards. In 2020, she also has a number of other awards, and we're happy to have her expertise on board to talk about the field of periodontology and implantology. We actually had one other session about this earlier, and I know we have a growing number of pre-dental students, so I hope that all of you enjoy this session. I have a few reminders to those who might be new to virtual shadowing. Towards the end of each of these sessions, we have a Q&A. So let's say you have a few questions for Dr. Daultani that you'd like to be answered. You can type in those questions in the chat. And at the very end, towards the last 15 or so minutes, we will have that dedicated time for a Q&A where I will read out those questions in order of the ones that we receive, and we'll be able to go through them. So feel free to type them in the chat. Also, if you'd like to stay tuned with future shadowing sessions, we usually have this on a Monday and Thursday basis, usually at 7 p.m., but sometimes the times vary, 7 p.m. Central, that is. And just to stay tuned with the times and days, because there is some variance time to time, be sure to follow us on Instagram, and also you can also join us on our listserv, which is an email listserv sent on Tuesdays. Every Tuesday morning, we include the flyers and names of speakers for the upcoming session. So those are two great ways to stay tuned with us. But with those reminders out of the way, if you guys have any questions for us about virtual shadowing, feel free to email us at shadowing.h4h@gmail.com, and we can answer any questions for you, just in case I didn't cover anything that you might have asked about, right? If you want to ask about something specifically, you can reach out to us. But with that out of the way, Dr. Daultani, feel free to take it away.
Yeah, first of all, I think I should say good morning from India. So because it's here 5:30 a.m. early morning, it might be evening here. So I'm Dr. Mohini Daultani. I'm a periodontist and implantologist. I'm practicing in Vashi, Navi Mumbai. So I'll be covering the presentation under following contents: the introduction, background, the achievement and award, how a typical day is like, all about terminology and terminologies that we use very commonly, and cases and take-home message. So a brief introduction about me before I get into it. I've completed my BDS and MDS from Krishna Dental College, Karat. I've been affiliated by Associate Fellowship of Laser Dentistry, that is affiliated by World Clinical Laser Institute, USA, that's WCLI. So this is my clinic at Vashi, Navi Mumbai, that is Advanced Orthopedic and Dental Care. As you could see, this is along with my husband, who is a knee replacement super specialist. This is the fellowship that I've received on laser, because laser is a topic that I'm very much interested in. And this is where I've passed off from, BDS and MDS, both. This is little about my personal journey. 2016, I had completed my master's. 17, I got married. And in 2020, I was a mother. There is a reason putting this picture into it, because even at this stage of transition of your life, because in girls, we go through this transition, the journey for your career and your passion should never stop. So even despite getting all this transitions in my life, the passion that I had for was always continued. And presently also I'm a consultant at Apollo Hospital, Navi Mumbai. So also I'm very passionate about painting, just a few gist about it. These are my few paintings. Also, as a doctor, but obvious, we have to do community services. We do free health checkup camps for the underprivileged students. Also, we give online lectures about oral health awareness to the people required. Few achievements to go for. I'm a brand ambassador at Dental Rich Digital Magazine. Also an associate editor of Contemporary Research Journal of Multidisciplinary Sciences. This page is designed by me, the journal page. I'm the author of book titled of Fundamental of Lasers in Periodontics and Basics of Laser in Dentistry. I have been a speaker at Dental Reach Dental Diva Summit 2020. Now to start with clinical case presentations. There are few clinical cases I had presented and where I had also received few awards. These are the articles published. So I would always want put up these articles as a doctor, just not that you get a degree and you get passed out. People will surely take into consideration your CV. So you have to do few extracurricular activities like what I showed you. You have to do community health services. You have to publish books. You also have to do publishing of articles. So these are my few articles that I had published in PubMed indexed. So even after that, the things are never ending. So even if you get passed out, and despite being passed out in the year of 2016, I still presently keep writing articles because in that way you also keep upgrading your knowledge. These are the few online webinars I had given when COVID was into high peak. This was my Podina presented at Global Summit at international platform. And I've done a lot of shadowing programs with many of the things. And there's a few awards of the Indias. So this is one of the very well-renowned, considered as dental Oscars in India, that is Famdent Excellence in Dentistry Award. I had received Emerging Speaker of the Award, Periodontist of the Year Award, Doctors Excellency Icon Award, Top 100 Doctors by DCA 2020, Periodontist of the Year by Famdent Excellence in Dentistry Award. I also conduct courses on suture, suturing technique, and about also perio, all related to flaps, fundamental of flaps with many of the academies. Now, how a typical day look like? Actually, when you start with your morning session, butterwist, you're a mother, you do a lot of household activities, and then you just rush up to your clinic. So my clinic time is around 10 to 2. So once I go, we have a lot of OPDs lined up. We have surgeries lined up. Also, when I come back in the afternoon session after completing your mother duty, when my baby sleeps off, I do article writing up. I have a lot of presentations, like as I'm connected with you. So I had a dental shadowing program. So I prepare my presentations at that time. And why I became a periodontist. So when I was in my BDS, that is Bachelor of my Dental Surgery, in 5 years of curricula, during the end of your 4th year, so the last year what you have, you start assisting your seniors, right? So when you start assisting your seniors, you come to know, okay, this is about this field. So when you assist an endodontist, you come to know, okay, it's all about root canal. When you assist a periodontist, a person who is doing PG in perio, you come to know about surgeries. So in that time, I was very much fascinated about surgery. So that is where I came to know, no, this is the field I have to opt for. Because whatever in India, we have 9 fields. So from that, which I like for is what I had to decide when I was in my BDS last year and in internship. In internship, you do a lot of your cases, you assist your PGs and all. So in that time, you come to know, okay, this is the subject that I should go for. All about periodontology you should know. Ideally, a smile is a reflection of your confidence, kindness, communication, joy, success, and affection. So the smile is just not a reflection of your teeth, but it has to be in harmony with your gingival tissues also. Both of them go hand in hand. Ideally, they say gums are like, it is a small pink tissue, but can make a very big issue if it is neglected. Okay, so what is periodontitis? Periodontal disease comprise of group of inflammatory condition that is of supporting tissues of teeth caused by group of specific microorganism in progressive destruction of periodontal ligament and alveolar bone. So as you could see, this is your healthy teeth surrounded by a good amount of bone and gums. So once you have inflammation of gums, that is called as gingivitis, and when it also involves bone, that is called as periodontitis. What are the common terminologies we use? This is about flap. A flap is a section of gingiva that is surgically separated from underlying tissues to provide visibility and access to the bone and root surface. Now coming up to the scaling. Scaling and root planing, also known as a conventional periodontal therapy, is a procedure involving removal of your dental plaque and calculus on tooth as well as your root surface. Now coming up to the frenum. What is frenum? It is a fold of skin or mucous membrane that supports or restricts the movement of part or an organ. Gingival depigmentation, it is a periodontal surgical procedures whereby the gingival hyperpigmentation is removed by various techniques. What is periodontal pocket? It is defined as a pathological deepening of your gingival sulcus. Coming up to recession, what is recession? It is the exposure of your teeth by apical migration of gingiva. Coming up to the next terminology, that is furcation. Invasion of bifurcation or trifurcation of multi-rooted teeth invaded by your periodontal microorganisms. Now coming up to the terminology of peri-implant mucositis. So ideally, you will see it is an inflammation involving gums. There is no loss of supporting bone following initial bone remodeling. It is a reversible condition. So as in your teeth, you have reversible condition, that is gingivitis. Same in implants, you have called a terminology peri-implant mucositis. Here you have bleeding on probing and gingival recession might be there. The probing depth is around 4 millimeters. The next terminology is peri-implantitis. As in your tooth, you have term called as periodontitis. For implant, the inflammation of your gums and bone is called as peri-implantitis. Bleeding on probing is present and the probing depth is more than 5 millimeters. What are the common complaints of patient visiting to your clinic? So a lot of patients I see of bleeding and inflamed gums, as you could see in this diagram. The people come to me with bad breath and loose teeth. Ideally, they say periodontal disease is a silent killer disease. So patient does not realize until it starts moving, until you have a lot of food lodgement. Right now, we have a very good awareness, so they are good enough to come to at a very early stage, but still in few parts, they're not aware, this is a serious problem to go for and I should visit a doctor. They come to us when they're in the last stage. Tongue tie, high frenal attachment, black gums, yellow teeth, receding gums. Lot of our patients we have, if they are right-handed user, they use a lot of heavy pressure, right? Because in India, they are still using a lot of manual toothbrushes. Very few are into electronic toothbrushes. So manual toothbrushing, being a right-hander, unknowingly you apply very heavy pressure. So you will just find recession at the single rooted tooth is very common here. Patients, I see a lot of missing teeth where we plan for implants. Now let me discuss few cases in depth so that you get an idea how do we treat few cases. So when a patient comes to me for bleeding and inflamed gums and bad breath, on examination, I found that there were deep pockets, bleeding gums, plaque and calculus present. So the treatment planned here was full mouth deep curettage under anesthesia. So this was the preoperative photograph. Anesthesia was given and with help of curette, each and every tooth was cleaned till the bone. So this is the post-operative photograph it looked like. We got the gums to their own healthy, we got it to the healthy tissue formation back to its original position. The next is depigmentation of gums with diode laser. This is one of the cosmetic procedure practiced very commonly here. Here the patient had complained about black dark gums. So on examination, I found the pigmentation to be quite dark and it was a thick biotype. So it's very essential whenever you do surgery, we check for the biotype. So what is a biotype? It is the actually thickness of your gingival tissues. How do you measure it? You put a probe into the sulcus of the teeth. So if probe is visible, your biotype is thin. And if probe is not visible, the biotype is thick. So whenever you do surgery, let it be any kind, I make sure to check the biotype of the tissue. So here we plan the depigmentation of gums with diode laser. You can also do depigmentation of your gums with scalpel, with burr, with laser, and with cryotherapy using nitrogen gas. So this is the post-operative photograph after doing diode laser. So you could see there is no bleeding at all. Why laser is so much used here? It's basically patient friendly. You do not have any bleeding. There are no cuts, no suture required. So patient is at very comfort when you do surgery. Post-operative healing is also very nice. This is the pre-op and post-op photographs of depigmentation with diode laser. Coming up to the next case for the missing teeth. Patient complained of missing teeth and wanted to replace it. So there was missing teeth in the posterior region. We planned to place implant in this region of 3.6 and 3.7. So what was done? Initially, the flap reflection was done. Osteotomy sites were prepared and the implants were placed into the position. Once the implants were placed, after 3 months, we called the patient and placed gingival former. So why is gingival former placed? To have a gingival collar around the implant. Then this is the prosthetic phase where you'd go for abutment trial, and here the prostheses are placed and are in occlusion. So this is how it looked pre-operatively and post-operatively. Next is endoperio lesion. Okay, as you could see, patient complained of pain and swelling in lower right back teeth region. So when I examined, it was a decade and I had a deep pocket present with forceps. As you could see, this is the buccal view and this is the occlusion view. Can you see this? This is a deep cavity that had involved pulp and also had a deep pocket. So there were two components at the same time. So after taking IOPA, we had first planned to do the endo treatment. So whenever you have two components in your place like endoperio, you make sure to go for your endo component treatment first and then perio. So once the root canal was completed, what I did, this was the healing observed after endodontic therapy. So you could see this was the swelling that patient came up with. And then this is the swelling reduced once the endodontic therapy was completed. This is open flap debridement that we planned with forceps. This is how, and we had even given prosthesis. So this is how the patient came to us pre-operatively, buccal view and occlusal view. Just see this buccal view and occlusal view, and it is along with the prosthesis. So first we did the endo component, you did the root canal, you cleared off the endo component part, then you did the perio component, and finally you went for the prosthesis. So whenever you have two lesions involved, endoperio, endoprosto, or perioprosto, whenever you have the first component to be treated is endo and then the other one. The last case is peri-implantitis. One of my colleagues had placed an implant and there was recession. So this is peri-implantitis, she had it around her teeth. So patient complained of anesthetic black line around front teeth region. So this is not anything black line. This is your exposed implant surface. So on examination, I found there was exposed collar and inadequate attached gingiva with 2-1. Also, I found this thing was neglected. So whenever you place implant, you have to look what it is surrounding by. Is my tissues healthy? Do I have a very good biotype or no? Do I have attached gingiva or no? The finding that she missed before was high frenal attachment. If this was relieved before doing implant placement, so this complication would have been avoided. So what we planned was laser decontamination and connective tissue graft placement with 2-1. So first, the full thickness flap was raised. Laser decontamination was done with diode laser. Outline for the graft harvestment was done. This is the connective tissue graft placed at the recipient side and sutures were placed. So this is how the post-operative photograph looked like. As you could see, here the exposed collar was there, the biotype is thin. We have made the tissues bulky. By placing connective tissue graft, you have improved your biotype and also we relieved the frenum force. So even it is free of frenal attachment completely. There are a few, this is all about the cases I completed. Now, I would like to have few advice to your dental students. Make sure you have 5 keys to success. First, you need to be ambitious, you need to be focused, you need to be dedicated and hard work. But if you have all these 4 qualities, it has to be accompanied with consistency. Consistency is not counted on day one, it is counted at day 100 and day 1000. Okay, so always make sure whenever you have those all keys, you have to be having the consistency in thing. So success is all about the iceberg illusion. Actually, what people see, okay, the person is so successful, but you have not seen the dedication that person has put up into the hard work, the discipline, the sacrifices, the failure, the disappointments, and persistence. So always remember, you will not have your success journey a very straight road path. It's all about ups and downs, and then that is how you reach to the top of the mountain. Advice for future dentists to go for. So whenever you are, you really want to make your skills very nice, make sure you try to learn from the dentist in your town. Check for the Google reviews. Visit those clinics with your professional resume. Connect with other dentists on social media platform. Because in today's era, you have social media that is going to help you a lot. Even if I'm in India, I keep on following pages of those renowned periodontists I'm really interested in. So when I see their work, I really like to do such kind of work more. Present your cases with watermark on social platforms. So what happens when you present that at social platform, there are few people who will give you comments and there are few people who are going to criticize you. So that is how you actually learn. Join Indian Dental Association membership or membership of your specialty. In India, we have Indian Dental Association. So I'm very sure you will be also having there. Keep upgrading, keep learning, attend conferences and courses because that is how you're going to upgrade your knowledge. Keep doing extracurricular activities like publication of your articles, webinars, and book publication. This really helps you a lot. So the take-home message is there are basically two kind of people you have. The one who will try in every situation and one who finds opportunity in every situation. So also check, know one thing, there are unsuccessful people use the failure reason and they keep it on the top of head. But the successful people, they'll try to find opportunity and they'll use that as a footstep to still go ahead. You are failed, you learn from your mistakes, you grow and you go ahead. Always make sure you focus on the solution and not the problem. There are no shortcuts to success. Every success story started with a dream. So if you have to dream before your dreams can come true, make sure you always believe in yourself. Don't say I wish, always say I will. So success is sum up of your see your goal, understand the obstacle, create a positive mental picture, clear your mind of self-doubt, embrace the challenge, stay on track, show the world that you can do it. So failure is not the opposite of success. It is actually the part of the success. Okay. So always make sure whenever you have a failure, just have that leap of faith, jump up, and the success will be on your other side for sure. So always unlock your potential. Know what are your potentials and unlock them and identify them. The first step will always be the harder, but not the next step for sure. So to have success, start, think, analyze, plan, try, do it, and keep going and never give up. So as to end, I would like to say, a winner is a dreamer who never gives up. So dream big, stay positive, work hard, and enjoy the journey. So this is all about my presentation. These are my all social media IDs. You could connect with me anytime if there's anything I could really help you out, and it would be a pleasure to help you all in any situation.
All right. Well, thank you again, Dr. Daultani, for all of the insight into cases and all. It was great to see
Yeah.
I wanted to dive into a few questions that we have. And as we go through these questions, to those listening in, feel free to type them in. You can even ask questions while we have the Q&A. My first
Yeah.
question is, being a physician who has received multiple awards, how have you made a name for yourself and been able to reach out to that level of recognition, especially for students? Having that will help them later on, for resume purposes and all. So it's interesting to hear from your side, from someone who's experienced that, what it is.
See, about right from very start, I was very clear. I just don't want to be a clinician, complete my degree, get into clinic and start working. I always was very interested to be extracurricular. And I had recognized my very good quality right from before that I had a very good power of speech. So I was very clear when I was into my first year of my graduation that I wanted to be a speaker. So it was damn clear. So that's what I mentioned in my presentation. First, set your goals, understand what you want to do for. You can't just be a clinician. So what there are a lot of clinicians like you. So what will make you out of the box? The one quality that you have in yourself extra. So make sure, identify that and keep doing a lot of extracurricular things. As I mentioned, put your watermark on your cases, put it on social media platform. You get to learn so much. Even people who are criticizing you, they are the ones who actually you are going to learn from them a lot. Keep doing extracurricular activities. You can put in online presentation, attend courses, conferences, keep upgrading your knowledge. And there are a lot of even platforms where, if you're applying for your awards, you don't get awards like this only. You have to send them your resume. So your resume has to be that strong. To make that very resume strong, you have to build up your portfolio very nicely. So have that your goals, keep doing extracurricular activities, and this is all then possible.
You mentioned research earlier on, also as something that you're continuing to do as a professional. For students who want to be involved in research, it would be nice to hear, how did you find your way into a certain niche area, like a certain specialty of research that you were most interested in? What was the process for you?
See, to identify what niche I'm really interested in, I have to go and assist all those niche that options are available. So if you have 5 options with you, like you have endodontist, like we have your 9 branches, I chose out only 5 or 4, and I went and assisted each of them. So when I actually see what kind of work they do, then I come to know what is my niche I can really go for. As I said I started when I actually assisted a periodontist in my college in my last year and my internship. I came to know I want to be a periodontist. So when you are assisting a root canal specialist doctor, I'm just talking in simple language so that it's very easy to. So if you come to know, okay, root canal is my field, then understand, go and assist them and just check how is their day, how is their routine. Now dental shadowing, this I'm doing online. I just showed you a few of my cases. You just got the gist. So if you're interested in perio, you should go and assist them. You could just say, okay, I just want to see your cases. If I'd be glad if you could allow me to assist. Then when you assist your 4 to 5 options, then you can find the one option that you're really interested, your one niche that you want to go for your specialization.
You also published 2 books. So what was the process and timeline of publishing? What did you learn from that experience?
I learned instead of learning, like I learned a lot. So when you have to publish your book, you make sure that you just don't know the A, you know A to Z about that. So before publishing a book, I read so many articles. As I said, the laser was my prime from very before. I was really fascinated about lasers. So I read so many articles. So my knowledge added up a lot. So that helped me to increase my knowledge and it was amazing. So if you like anything, make sure that you want to excel it, just go for it and then you can have this also.
And past shadowing, were there any other ways that students here can maybe get themselves involved in periodontology and implantology? Are there any, like, for example, associate positions that students at your practice or just generally can involve themselves in for more exposure?
Yeah, you have a lot of course conductions, like you have 2 days workshop, you have conferences and all. So you can attend the 2 days workshop also, and you can have a gist about perio also, about the surgeries. Like in India, we have 2 days workshops. So like I'm a speaker at few academies. I go and teach them. There are topics like sutures and suturing technique. The other topics are all about basics of flaps and incisions. So when you attend such even 2 days workshop, you get a gist about it. Like
As a professional, also, do you mentor students? What do you find in students that is most important for mentorship?
from point or student's point, like
Yeah, from this point of students, from the perspective of students, what do you find most important for them during the time of mentorship?
so I feel like you should have thirst for your learning. It is just not that you come and you attend the course. You have to have the thirst about the learning. You have to make sure that you understand everything in depth, and make sure if you have come up for any subject, you have to ask them. You have to make sure what they have taught, have you understood them? And it's just not theoretical. Like when we have even 2 days workshop, so you have lectures, you have demonstration on your models, it could be goat model or anything, and then you even do it on patients. So each and every step you clear it up, and you do it yourself. So doing all those exercises under the guidance of your mentor is very important. So make sure from students' perspective, you attend any kind of workshop, you do all those exercises, what they're saying you, like see, for example, in my uh, field, you have sutures and suturing techniques. So initially we tell you to do it on a goat model, or we tell you to do it on a pig jaw. So wherever we tell you, you do those exercises, you learn theoretically from them from the lecture, but do all those exercises under the mentor. That is how you start getting that confidence, and you will master the skill eventually.
You mentioned that you're involved in private clinics. So in India, I'm not too familiar, and the students here are mainly in the US. Could you familiarize us with more so the structure of private clinics and the public healthcare setting in India too?
So here private clinic, once you are a graduate like bachelor clinic, you can open up your own private clinic. So what are the options after BJS? Either you go and you join as an associate dentist and you assist them, or you can open up your own clinic. And after doing masters, initially if you want, you can be a consultant in few clinics, and then you can open up your clinic. So for me, in 2016 is when I had done my master's, but for my husband's reason, I was at Hyderabad for 1 year. So in that time, I joined as an associate with a clinic. I handled a 3 chairs clinic because I thought, there's something still I have to learn. So that is how even you get to learn from so many clinicians. So there I was, and when I came back to India, when I came back to Bombay, I again joined as a consultant in many clinics. Okay. And then I opened up my own clinic in 2020. So that is how I thought, like in India, you can open up your clinic once you're a graduate. If you don't want to open up your clinic, you can join as an associate dentist in any of the other clinics. As a master's, you can join as a consultant, or also you can join into public health sector where you can, do for community health services. If you're very interested in writing up article, you could do those research design courses and get into the research field.
Also, just generally within healthcare, there's a lot of ways to get involved. Like, for example, with shadowing, we have physicians, dentists, other healthcare professionals. Did you ever think about other fields like medicine or others before you went into dentistry, or was it always dentistry for you?
No, I was very clear from the beginning that I want to be a dentist. I had actually got an opportunity where I was a merit student where my rank was 11th merit rank all over India. I was getting MBBS, but I did not opt for it because I was very clear I wanted to be a dentist. Even after getting into dentistry of my first year, at the end, the HODs had said, "So you're very capable student of getting into MBBS. You could really switch if you want." I said, "No, I want to be a dentist and I want to be a surgeon." Was very clear about it.
What are the other specialties outside of periodontics and implantology that are available in dentistry in India?
In dentistry, you have other fields are your like endodontist. Endodontist is a root canal specialist. The next was is your prosthodontist, that is related to your crown and bridge and implant. Then is perio, that you all people know. The next is your OMDR, that is oral medicine diagnosis and radiology. Okay, then fifth is your oral pathology, related to all about your tissues and identifying the pathology about it. Then you have public health. Public health dentistry is there. You have pedodontist. Okay, pedodontist related to all the children specialty. Then you have oral surgery field related to extractions and fractures and all the surgeries. So you have this 8 to 9 fields in India for the masters.
Looking back, when you were a student, what's one thing that you wish you knew, but now know now?
I wish I could have knew that, there are still the social media platform. Now I know that it is in full swing, but I wish I could have knew before. So the options, the post after my master's for the fellowship, I wish I could have knew that before. I did it in 2021, the associate fellowship. So if I would have knew it before. So that awareness wasn't very much. See, you people are right now in full social media platform. There's so much of awareness. It was not then before. So I wish that would have been before. It would have helped us a lot in many ways. So that's what, as a student for you people have that opportunity, you have that platform, use it completely. And there are so many options you can come to know. Just sitting at your home, you can come to know what are all the options available in the entire world.
Absolutely, that's very true. Also, in terms of your training, could you dive into and elaborate a little more about the timeline? How many years you spent with dental school? How many years you spent with training? If there's, like in America, we talk about fellowships, right? After a residency, if there's fellowships available in India?
See, my course was graduation was for 5 years, of which 4 years was of learning and 1 year is of internship. So we have 5 years I had completed. After that, I had given my entrance exam for my master's, and master's were of 3 years. So total, we had spent 8 years of our career for becoming a master. And after that, I had joined I had told you, like I had joined as a consultant at many clinics. And fellowships, you can apply them, you can get them. There are few fellowships who have exams, few fellowships do not have exams. You can get into that, and that could be 1 month course, 2 month course, and also it could be 5 days course for the fellowship. So that is how it is in India, 5 plus 3.
All right. Also, we hear sometimes different names for the dental degree. Like, for example, you mentioned master's. Another name for it I've heard is bachelor in dental surgery. Are these roughly the same thing, or are there differences between them?
That is the same thing. Bachelor of dental surgery is here. Graduation and post-graduation is called as Masters of Dental Surgery, MDS.
Okay. In terms of your admission with getting into dental school, how did you make yourself stand out as an applicant? Was it mainly based on test scores, or is extracurricular something that's also involved?
For Bachelor of Dental Surgery, BDS, MDS both, we have to give an entrance test that is called as CET, Common Entrance Test. So once you apply here in India, so you're eligible for all the medical options like dental, MBBS, physiotherapy, pharmacy. So once you give this common entrance test, that is entrance examination, your score comes up. So once the score comes up, then they check your eligibility criteria. Here the 50% passing is your criteria, and the person who stood the highest, the ranking, you get your 2 rankings here right now, state rank and the national rank. Accordingly, then you can apply here for the schools. This is the format in India.
Are the schools mainly government funded, or are there also private schools?
Government and private both.
Okay, I see. And do they have any differences with admissions between the two, or are they the same?
In government, the course fees are quite less, and in private, the fees are quite high.
Okay. Also, during the time of training, like for example, we hear about this with medicine. Some people will have their medical school in India and then transfer to the US. Have you heard about that for dentistry too?
Yes, there are a lot of my friends who completed their Bachelor of Dental Surgery, that is graduation from here, and then they went to US, they gave their exams, that is part one and part two, NBDE, and then they entered into DDS, Diploma in Dental Surgery of 2 years course. So a lot of my friends have done that.
You're also the associate editor of one journal. I wanted to ask, what's the process of being an associate editor? What kind of things do you look for in an article?
So as an associate editor, I always check about what kind of references they have used, how how strong is your case, and how much is your follow-up. Follow-up is very essential key for a publication of an article. You should have a good clinical photograph, good follow-up of at least minimum 1 to 3 years, and your good writing skills so that it's very easy to understand by everyone.
Our earlier speaker for periodontology was also specialized in laser surgery. So I was curious to ask, is there what kind of special connection does periodontology have with laser surgery? Why are they kind of coupled together?
Because see, for laser is basically used for surgery, and the surgery is mainly done by your periodontist or your oral surgeon. Because we deal with the tissues, gums. So if I'm using scalpel. So if I use scalpel, you have a lot of bleeding and all. So that is why laser came into a lot of use by a periodontist. So I am using that as my tool, like that.
Okay, I see. And I guess just a few last questions for you. You mentioned earlier some specialties that are also involved, like oral surgery, and there's also pediatric dentistry, et cetera. Which of those specialties do you most closely work with?
I mostly work with prosthodontist and endodontist. So you have endoperio lesion, you have prostoperio relation. So that is the two specialty I mostly work with, like that.
All right. Okay, sounds good. Well, any last words that you have? Any last pieces of advice for students out there?
I would like to say, so this is your time. You have to learn and you have to excel. Make sure you are excelling in every field. You don't give your 100%, you give your 101%. That 1% extra is really going to add up the cherry on cake for your career. So make sure always have that consistency. That's what I told you, the 5 keys of success. Consistency is key for anything. You might be determined, you might be focused, you're very sincere, but if you're not consistent, you will not last till the last. So make sure keep your hard work going and be consistent and keep upgrading. Have that thirst of knowledge. I still have it despite being it. After being masters, I still feel I have so much to learn and so much to excel.
Absolutely. It's always a learning process, always a learning journey with really almost any career in healthcare. All right. Well, I think we're going to wrap up our session there. Thank you again so much, Dr. Daultani, for all of this. It was great to see the cases, great to hear the advice, great to hear more about your own personal journey. It's very, very helpful for students when they're looking forward to a career later along the line. To those listening to us for our shadowers, to earn credit for your attendance today, you must pass the quiz to receive a certificate. That quiz is now posted in the chat box. It's also available on our website under the virtual shouting page. If you click on that website and click onto our virtual shouting page specifically, scroll down a bit and you'll see our Monday quiz for Dr. Daultani. Click onto that and then you'll be directed to our Google form. That quiz must be passed with at least 6 out of those 10 questions or 60% in order for you to pass and receive that certificate. It will be due next week on Sunday, September 11th, I think it's going to be, but it will be this Sunday. I don't have the exact date. At 11:59 p.m. Central Standard Time. So be sure to complete it by then. We recommend to just kind of complete it right now so you already have the information fresh in your head. Once you do pass that quiz, like I said, you will receive a certificate, which will be sent to the inbox to the email address you list on the quiz. We recommend that you include a Gmail or a Yahoo email because personal emails tend to work better. Sometimes when you use a school email, it will direct it to your spam. And just in case you don't find your folder, please check your spam folder. in case it's not there, feel free to contact us again through shadowing.h4h, the letter 4 or the number 4, I should say, h@gmail.com, and we'll be able to answer any questions and just help you retrieve your certificate in case it gets lost anywhere. For our next shadowing session, like I said, we have it on Mondays and Thursdays. So we're going to have one this Thursday with Dr. Barrett. She is a neurologist who is the Neurorehabilitation Division Program Director at the Emory Brain Health Center. A very passionate neurologist. We're planning to have her earlier in the summer, but we rescheduled. So this is going to be the one for Dr. Barrett. I know that quite a lot of you were very, very interested for that one. And that's going to be at 7 p.m. Central, like usual. Again, this Thursday, September 8th. And like I said in the beginning, if you want to just stay updated with future shadowing sessions, feel free to either follow us on Instagram, where we post our flyers, or subscribe to our listserv by either emailing us with your name and email, and we'll add you on, or you can go onto our website. We have a subscription form at the very bottom. You can write in your name, your email, and submit that subscription form. You're also going to be added through that. But with that said, Dr. Daultani, thank you so much. Dr. Daultani also, I believe you left your Instagram, I think, right on that presentation. Yeah, so if you want to contact her, feel free to contact her at her Instagram handle. I'm sure she'd be happy to help with anything. But again, Thank you so much, Dr. Daultani. It was really an honor to hear from you.
Thank you. Thank you so much. It was a pleasure talking at your platform. And your people are doing a great work, helping out so many students out there.
We appreciate it. All right. Well, enjoy everyone's Labor Day, and we'll see you later on Thursday.